Hi, Dr. Paul here. So I want to explain the most common thing I see in my practice, which is anxiety disorders. It's probably statistically the most common mental illness. And it comes in various types. There we have social anxiety, where people really have a hard time going out and meeting people, especially new people. We call generalized anxiety disorder, which is people basically who have anxiety just a lot of the time in general. We have panic attacks and panic disorder. And panic attacks, if anyone who's ever seen one or know one or had one, they're miserable. You can't breathe, you're shaking, your chest is tight, you think you're going to die. A lot of people end up in the ER with these, and because they just feel like your heart's going to explode or something, and so that's bad. And also there's general anxiety around certain things like phobias, like airplanes is a common one, flying, public speaking is really common. Believe it or not, fear of dying, of course, that's a really common one. But there's certain things that bring on anxiety. And the thing about anxiety too is people are always trying to figure out why they have it, because sometimes people say to me, I can't explain it because nothing is going around in my life that should make me anxious. Why am I so anxious right now? Some people can identify, okay, well, that's making me anxious. So of course, that makes sense why I'm anxious, because this or this or this. But some people say, I don't know why. My life is good. Everything's fine. I don't understand. So people are always trying to explain why they have anxiety when sometimes it's not that easy to really understand, because it's something you can't help. It's something you have no control over. And that brings on anxiety. The fact that you don't have control over it brings on more anxiety, because you just don't know when it's coming. And the reasons why it happens: genetic predisposition that runs in your family, that's the number one. Hormone change times like puberty, like premenstrual, postpartum, menopause. Men and women, men in puberty, men in menopause, which are called male menopause. Stressors, trauma, stressful events happening, divorces, death, fired from a job, just a lot of things can cause anxiety. So let me explain some of the basic neurochemistry. So how do you treat it? Well, again, there's obviously a lot of things. I talk about breathing techniques with my clients, how to breathe properly when you have anxiety. You have to exercise, how to get out and exercise. Things like meditation, yoga can help. Seeing a counselor can help. If you have things that you have to work on with a psychologist, that can help. But medications are my field. That's my specialty, and that's what I do a really good job with. So if we look back at my basic neurochemical drawings here about neurons, so we got basically, again, neurons are over 100 billion of them in the body. The chemicals are traveling at a rapid rate around the body 1,000 times a second, over 100 trillion connections between the cells, which are called the synapses. So a lot of stuff's going on at a rapid rate. So what causes, serotonin imbalance is very common, because it's supposed to be, serotonin is supposed to be moving forward. Norepinephrine is supposed to be moving forward. Dopamine usually is supposed to be forward, and GABA. So these are the four basic neurochemicals here that I work with. So the problem usually is that there's a leakage on the membrane, and the chemicals that are supposed to be going forward go backward. We call it neurochemical imbalances, and that's not good. If they should be going this way, not that way. So a basic treatment would be an SSRI. It's not. A lot of doctors think it's the first line of treatment. I disagree. I think they're okay. But what they do is they balance serotonin. So they go to the serotonin site. They attach there. They block the uptake, and they force serotonin to move forward. I have better luck with SNRIs, so serotonin and norepinephrine medication. And the NRI is reuptake inhibitor. So they're inhibiting the reuptake because they attach to the sites and they stop the backflow. And they force these chemicals to move forward. So these are the basic chemicals I look at when it comes to anxiety. I first look at norepinephrine and then serotonin, these two. And then also look at GABA. GABA is also another one. It's kind of a sleeper. A lot of doctors ignore it. They don't understand it very well. But sometimes GABA is moving backwards, and it should be moving forward. And so, some things like gabapentin, you might have heard of, Topamax. These are medications that attach, and then they get GABA moving the right way. And so sometimes a combination of one of these and one of these is very, very helpful, for especially for tougher anxiety. Sometimes it's just one medication. Sometimes one thing is all it takes, and you're good to go. Dopamine sometimes is involved, so I also think about dopamine. That's more often related to depression, which we'll talk about another video. But that's kind of the basics of what I do. It's not always that easy. Sometimes it takes a little while, but really for my patients, one visit is, I often get it right. 2, maybe 3 at the outside. So I work very quickly. I decide what's going to. I have a really good feel for what's going to work the best, and I have very good odds of what, because I've been doing this a long time, and I kind of get a really good feeling about what medication is going to be right for what person. So I work quickly. I usually get people much better within 1 week of the first visit. Believe it or not. And then by the next visit, if there's any residual anxiety after adjusting the medication, I usually have the patient call me in a week, and I adjust things if I need to. And then if I need to, I'll add something else. If the anxiety is not completely gone, I'll switch it. If the medication isn't working out, I'll switch it. So it just doesn't take very long to get anxiety under control. And then when that's the case, the person feels in control. Anxiety doesn't affect them anymore, and it just changes their life. So it's really important to treat anxiety properly.